If you are over 60 and you wake up with that strange buzzing in your feet, or you feel like you are walking on cotton wool, or maybe you have that burning sensation that feels like hot needles pricking your toes, I need you to listen very closely. Most doctors will look at your chart, see your age, whether you are 64 or 83, and they will tell you this is just part of getting older. Or they might call it idiopathic neuropathy, which is fancy medical speak for we don't know why your nerves are dying. I am Dr. Oleksii Kalmykov. In my years of practice and research into internal medicine, I have found that aging is rarely the root cause. Your nerves are not dying because of the calendar. They are dying because they are starving. Today, we are going to fix that starvation. We are going to talk about the one specific fuel your nerves need to repair their protective coating, the myelin sheath, and why the standard vitamin B supplements you buy at the pharmacy are useless for 90% of you. I'm looking at the comments from our community right now, and it breaks my heart because I see the same story repeated from every corner of the globe. I see Imtiaz, 83 years old, watching from Sterling, Virginia. I see Eloy, 71, in Manila. I see Rosalinda, 74, also from the Philippines, dealing with terrible pain in her left arm after chemotherapy. And I see many of you, like Philip in Tasmania, 84 years old, asking the most painful question of all. He wrote, "Feet, why won't you move?" Philip, your feet want to move, but the signal isn't getting through. Imagine you have a high-speed internet cable, but the rubber coating on the outside is stripped away. The signal leaks out. It turns into static. That static is the tingling. That static is the pain. And when the wire is completely bare, that is the numbness. So why does this happen specifically after 60? And why does it happen even if you eat healthy? Here's the medical reality that most general practitioners miss. It's about bioavailability. You've been told to take vitamin B1, thiamine, and Dr. Emily Carter's video, which many of you watched, was correct that B1 is the key. But here's the problem she didn't fully explain. Standard vitamin B1, thiamine hydrochloride, is water-soluble. It dissolves in water. But your nerves are wrapped in fat. The myelin sheath is a fatty layer. Trying to fix a fatty nerve sheath with a water-soluble vitamin is like trying to mix oil and water. It simply slides right off. You can take 100 milligrams of cheap B1 and maybe 5 milligrams actually get inside the nerve cell. The rest, you flush it out in the bathroom 2 hours later. This is why you can have normal blood test results but still have dying nerves. Imtiaz, I saw your comment that you are going to check your B levels before proceeding. I have to warn you, a standard blood serum test will show how much B1 is floating in your blood, not how much is inside your nerve cells. You can be drowning in B1 in your blood and starving in your nerves. This brings us to the solution. It's not magic, it's chemistry. We need a version of vitamin B1 that is lipophilic. That means fat-loving. We need a molecule that can pass through the fatty wall of your nerve cells and get to the mitochondria, the engine room, to turn the lights back on. This molecule is called benfotiamine. Benfotiamine is distinct because it has an open ring structure that allows it to pass directly through cell membranes. Studies suggest it's up to 360% more bioavailable than standard thiamine. When you take benfotiamine, it penetrates the nerve sheath. Once inside, it closes its ring structure and becomes active B1. It's a Trojan horse that smuggles the medicine exactly where the enemy is hiding. Now, I want to address a very specific concern raised by a viewer named MWHanson in the comments. He warned that benfotiamine is fat-soluble and can lead to toxicity because it stays in the body longer. This is a valid scientific question, and as a professor, I appreciate the skepticism. However, here's the nuance. While benfotiamine is fat-soluble to get in, once it enters the cell, it converts into active thiamine, which the body regulates. Unlike vitamin A or vitamin D, which can accumulate to toxic levels in the liver, benfotiamine has a very high safety profile in clinical trials, even at high doses used for diabetic neuropathy.
However, safety is paramount. We do not guess with our health. We follow the protocol. If you are suffering from what we call stocking glove neuropathy, where it feels like you are wearing socks or gloves even when you aren't, here is the approach I recommend for my patients to discuss with their primary care provider. Phase 1 is the loading phase. You need to saturate the nerves. The standard dose of 100 milligrams is often too low for repair. We typically look at 300 to 600 milligrams of benfotiamine daily. Split this into 2 doses, morning and evening. Why? Because even though it lasts longer than water-soluble B1, we want a constant supply for the nerve repair enzymes. Phase 2 is the synergy phase. Benfotiamine is the bricklayer, but you need mortar. Rosalinda, for your specific situation with the arm and lymphedema, and for those of you with diabetes like Isaiah from Papua New Guinea who is 56 years old, benfotiamine works best when paired with alpha-lipoic acid, or ALA. ALA is a powerful antioxidant that reduces the oxidative stress that is rusting your nerves. Benfotiamine fixes the energy. ALA cleans up the rust. Now, what results can you expect? I want to be very honest with you. This is not a painkiller. It does not work in 20 minutes. Nerves are the slowest healing tissue in the human body. In weeks 1 and 2, you might not feel less pain. In fact, some patients report more tingling. Do not panic. This is often a sign of waking up. A dead nerve feels nothing. A healing nerve feels everything. This is called re-innervation sensation. By weeks 3 to 6, this is where the burning usually starts to subside. The hot needles turn into a dull awareness. By month 3, this is where we check for sensation returning. Can you feel the texture of the carpet? Can you feel the difference between hot and cold water? I want to speak directly to the skeptics and the failed cases. Virginia, watching from Alberta, Canada, you mentioned you had C5-C6 surgery and your hand is worse. This is common. Surgery decompresses the nerve, but it causes trauma. The nerve is now breathing, but it is bruised and battered. Surgery removes the pressure. Nutrition repairs the wire. Benfotiamine is critical for post-surgical nerve recovery because it drives the transketolase enzyme, basically the enzyme that clears out toxic sugar byproducts that prevent healing. And for Libertayama in Amsterdam, 59 years old, asking about heel pain, if it is plantar fasciitis, B1 helps, but it is mechanical. However, if it is burning heel pain that happens at night, that is often the start of small fiber neuropathy. Benfotiamine is your first line of defense. We are building a global map of recovery here. I am amazed by this community. We have 90-year-olds in South India, 80-year-olds in Malaysia, 57-year-olds in Japan. You are not alone in this pain. Here is my challenge to you. I want you to try the benfotiamine protocol for 14 days, just 2 weeks. Do not stop your current medications. We work with your doctor, not against them. But add this fuel to your tank. If you are in the US, the UK, India, or Australia, benfotiamine is available over the counter. You do not need a prescription, but you do need to check the label. And sure, it says benfotiamine and not just thiamine mononitrate. And please, come back to this video. I want to see a comment from Philip in Tasmania saying his feet are moving again. I want to see Rosalinda saying the pain in her arm has gone from an 8 to a 3. I am Dr. Oleksii Kalmykov. We do not accept getting old as a diagnosis. We find the cause and we fix it. Hit that subscribe button so we can keep troubleshooting your health together. I'll see you in the comments.